Child Protective Services, law enforcement, prosecutors, victim advocates, and mental health experts to investigate cases of sexual and physical abuse of children in a way that puts the children at the center. The multidisciplinary approach and our child-friendly setting at Safe Harbor ensures that the process is as child-focused as possible while creating the optimal circumstances to effectively hold offenders accountable. Child Advocacy Centers, or CACs, like Safe Harbor, play a vital role in keeping the communities healthy and safe. CAC communities see almost double the rate of felony convictions in child abuse cases than non-CAC communities. So we're very fortunate that Safe Harbor is here serving this community. Children in CAC communities are also more likely to receive the medical and mental health care that they need in order to heal. Since we started in 2008, Safe Harbor has helped nearly 5,000 children in our community find their path to healing and justice. Today, we are gathering to acknowledge the more than 9,700 child victims reported as alleged victims of abuse in our region over the past year. So in fact, the actual number is 9,777. So our vision is for safety of all children, and for those who have experienced abuse, that they now experience healing and justice. We rely on donations for the support of our work, and we're fortunate to have a very strong support in our region.
In addition to being on City Council, I'm also a licensed clinical social worker. I've worked as a child, adolescent, family therapist for over 30 years and know firsthand that Safe Harbor is a vital community service for child survivors of abuse and their non-abusing family members. Children are not just little adults. Their ways of relationship building and communication are different from adults. Children may communicate that they are hurting by not sleeping, wetting the bed, being irritable, distractible, falling behind in school, or failing to establish friendships. Children may demonstrate that they are healing by including you in their building with Legos, or in playing with a dollhouse, or sharing what happened in school that day. They may show you they're progressing by playing with another child at recess, agreeing to join an after-school club, thank you, or simply by letting their guard down enough to be silly. Child survivors of sexual and physical abuse need a safe place where they can tell their story to people who specialize in working with children in a coordinated treatment model. Safe Harbor offers a one-stop shop for children to tell their stories to specially trained forensic interviewers and advocates. Then Safe Harbor connects children and their non-offending caregivers to the medical, mental health treatment, thank you, and advocacy they need to heal. Unfortunately, this help is needed far more than most of us know. Last year alone in Fredericksburg and our surrounding counties, there were close to 10,000 child victims of alleged physical and/or sexual abuse. Today, we say their ages and protect their identities by using Jane or John Doe for their names.
Jane Doe, age 13. Jane Doe, age 16. John Doe, age 11. John Doe, age 8. Jane Doe, age 15. John Doe, age 4. Jane Doe, age 11. Jane Doe, age 15. Jane Doe, age 4. John Doe, age 10. Jane Doe, age 9. Jane Doe, age 13.
I will be thinking of the names of some of the children I've worked with throughout the years who have suffered at the hands of people they trusted. Children do not have the same rights or opportunities as adults. They can't press charges, they can't vote, and they can't move out of their abusive situations without adults to help them. They can't find therapists on their own or get themselves to appointments. Safe Harbor supports children and helps them navigate their way to healing. I am honored to be here today to stand for the children, for our children, and acknowledge their suffering and healing.
Jane Doe 13, John Doe 8, Jane Doe 7, Jane Doe 3, Jane Doe 12, John Doe 3, Jane Doe 11, John Doe 7,